When I first heard about QT, quantitative transmission imaging, I thought, okay, I gotta do my homework, I gotta do my research, and that's what I did. Before we bring anything into the clinic, I do extensive research, look at the studies, look at the validity of it, and make sure it's the best thing. And after extensive review, I was like, oh no, this is amazing technology that is not injurious to the patient. The thing that excites me most about QT is the technology in and of itself. Interestingly enough, the National Cancer Institute and NIH said we need great technology for imaging for the breast and possibly the body. And so Dr. Klock was, given that project, and here we are today with the technology. And the problem with medicine is anything that is new and innovative, it takes physicians and practitioners a long time to adapt a new technology. But I've always been, this is my 40th year of working, and I am always looking for the latest, greatest technologies that won't injure, will not harm, will not cause immunosuppressive, it doesn't have dyes. This technology does that. But more importantly, this technology is looking at your breast with transmitted ultrasound, which is a very special kind of ultrasound that literally looks at the breast with so many different calculation and observations and so many angles. So it's not just like, okay, we're just looking at it in one area. They're looking at it in so many areas, calculating so much information. So the end result, when the radiologist looks at it, they are capturing an image that you can't get on any other available imaging we have today, like mammogram, ultrasound, or MRI. And the problems with mammograms, it's radiation. The more radiation we get, the more possible cancer causing. If we do MRIs, which is a physiological image, it is going to be utilized with gadolinium, which is very bad for your bones and your brain and the rest of your body. And it doesn't capture quite the image that you get on QT. So this is far superior. It will see the level of a human hair. Imagine that. The human hair, you're able to see that depth of an image. And the most beautiful thing is this is a beautiful image for women, and the process is painless and non-injurious. When technology comes out, it's usually the latest, greatest. We're constantly updating information and technology. And when it comes to imaging, this is a technology that's going to be used worldwide, and not just for the breast, but for the whole body. When I look at imaging, it typically says breasts are dense. When you're young, less than 40, mostly all women have dense breast. And with dense breast, you may miss significant pathology. So I tell everyone when they get a mammogram, it always says dense breast. In fact, I rarely ever see a patient that doesn't have dense breast. So I said, oh, why didn't the doctor order further imaging? If the breasts are dense, he or she should have ordered more detailed imaging, like an ultrasound. But now that we have QT is kind of where you should start, especially with women less than 40 because their breasts are dense. But even women after 40, typically I will see dense breast. And so QT will give us that detailed anatomical image of the breast. The reason why QT is so important is that there is no radiation. It was very cute. One of the patients said today that, oh, I'm gonna get a bath for my boobs. And I was like, okay, that's a good way for women to be more interested in the QT. I would say there's a 40% decline in getting breast imaging with mammograms because of radiation. So, but women don't know that this is an alternative now to denying getting mammograms because of the radiation and because of the squishing and the compression that patients undergo. They tell me it hurts, it's very uncomfortable, and what is it really doing to the tissue? So patients now are becoming very discriminating with their medical care. They want the best medical care that is creating health. They want non-injurious, non-inflammatory, non-toxic treatments and imaging. So QT is a painless, non-injurious, no dye, no radiation process.